Hello, my name is Dr. Sherwin Fernando. I'm an FY1 in West Midlands, and I'll be taking you through this presentation on SBAR and Handover. So SBAR is an effective communication tool, which is key in any multidisciplinary setting. The idea is that you're able to share information in a clear and concise way and reduce the amount of miscommunication. And does have a decent amount of evidence behind it, which is why it's regularly being used. SBAR can be divided into the four components. To start with, we describe the situation, what's going on with the patient. Why is it that you need to call this particular medical professional? It's always important in the situation segment to lead with the headline, why do you want this person to be seen? You need to grab the other person's attention. Moving on to background, we talk about the relevant clinical context and understanding around the patient. Now remember, being concise is key. So you need to only mention the relevant past medical history, drug history, and surgical history. And of course, any relevant events going on in the hospital or any actions. Assessment of the patient will typically take the ABCDE format or any assessments made during ward round. So you have to communicate any examination findings and any responses, or more importantly, lack of responses to treatment. Recommendation is your discussion with this particular professional. You need to ask what you should be doing, whether this person will be able to come and see the patient, and what you should be doing in the meantime, whilst this person is on the way to see the patient. It's also useful to discuss any follow-up for the patient if they're more stable and it's more of a sort of ward round kind of context. But SBAR communications typically occur from you as the junior to a registrar or consultant of another specialty to get their opinion. Now, when we discuss handover, handover is the period between different teams taking responsibility for a set of patients or for a singular patient. Typically, this is the day team handing over to the night team, or any new acute admissions being handed over by the ambulance crew. Handover can also occur when a patient is transferred between teams or to a different hospital. Now, ideally, the handover occurs with these particular steps. It's important to know who's in the team and who leads the team. Typically, this would be the medical registrar on call or potentially the medical consultant on call for any medical on-calls. By defining who's relinquishing responsibility and who's taking on responsibility, you ensure that all bases are covered, particularly when going from day to night. In addition, you should be discussing roles and responsibilities of each person on the new MDT. Now, importantly, this includes additional roles, such as the role in the cardiac arrest team. That is to say, are you the one doing the compressions or obtaining IV access, for example? Usually there's standardized pro forma in every hospital to document the proceedings. And that includes documenting people who are present, documenting any absences or any issues with either of the shifts. The team will also agree on a standardized system of communication and, most importantly, a list of the most immediate reviews required for patients, dependent on how unstable they are, as well as any jobs that need chasing throughout the shift. The outgoing team should make families and carers aware, as well as patients, when needed, as to when the care is being relinquished. And it is important in handover, whether you're the team handing over or being handed over to convey any additional concerns, particularly regarding availability of staff or of resources. The handover process is something which is included as part of mandatory training and is regularly audited in the hospital. Key tips for F1s. So I would say, in my experience, never forget to take a blank piece of paper to hand over. You always want to be writing out the patient details and locations for any problematic patients, as well as a vehicle to take any note of any important bleeps or numbers. As the F1 handing over, it's very important you have accurate information for patients, which include any hospital numbers or identification numbers, as well as their location. Ideally, you could just place a sticker on your particular piece of paper that you've been accumulating with any patients that you've needed to review throughout your shift. But please do ensure that you dispose of these pieces of paper with the appropriate means. Always be aware of your role, your responsibility, and your area of coverage. More often than not, you might be expected or asked to cover an area or a type of patient that is not appropriate. You can only raise concerns if that situation happens by being aware of your role and responsibilities. And if that were to happen, I would always recommend either speaking up or discussing it with your particular registrar. Finally, always ensure that you know the best places to rest and to get food. This is particularly applicable on twilight or night shifts. It's always important to take care of yourself. So that concludes my very quick talk on SBAR and handover. Best of luck on the wards.